only drug we have to fight swine flu, but a new report suggests the hazards could outweigh the benefits. The hazards could outweigh the benefits. The report calls for the Department of Health to change policy on the use of Tamiflu to treat swine flu. Research suggests that children aged between 1 and 12 are at risk of vomiting, dehydration and other complications. It's also been found that Tamiflu has little or no effect when treating asthma or ear infections.
What we get here is a symptomatic benefit of about 1 day reduction in the duration of illness. But what we don't get is any reduction in the complications.
What we found was the antivirals seemed to shorten the length of this illness by about 1 day in children under 12. In other words, 1 day quicker going back to school or 1 day less of symptoms. So it's a fairly small effect for an illness that usually lasts about a week.
And it had negative effects as well, didn't it?
Yes, about 1 in 20 children who are given Tamiflu will vomit more than they're vomiting anyway with the influenza. So there are side effects with these medications.
At the beginning of this epidemic, we also saw people being given Tamiflu or Relenza to prevent the spreading on of swine flu, and you found that that wasn't hugely effective either.
Yes, and we can be fairly clear. We found 3 trials which had looked at how effective these drugs are at preventing spread, because of course children are the main ones that bring the infection into the household. And we found that the effect is fairly small. There was an 8% reduction in the rate of influenza in children where influenza is coming into the family. In other words, you'd need to treat 13 children to prevent 1 getting influenza. So a fairly small effect on preventing transmission.
Now, we all know that the government has spent a lot of money making sure that we have an enormous amount of antiviral medicine to treat people who get flu. Does this suggest that they might perhaps be heading off in the wrong direction by doing that?
The results that we're presenting today show that the effect is fairly small for most children. Now, there will be some children with particular underlying health problems for which the situation may be different. What, of course, parents desperately would like to know is whether these antiviral drugs help to prevent their child developing a serious complication, such as pneumonia or being in hospital. And unfortunately, the trials that we've identified so far in this review just don't let us answer that question.
So to be clear, if you have a child who's not well, you think they might have swine flu, what would your advice be?
I think parents encounter these chest or respiratory illnesses every winter in their children. And I think most GPs would recommend the same advice, that if your child has got a mild respiratory illness, you should treat them with medicines perhaps to bring down a very high fever, keep them drinking, and most importantly, for the parent to keep an eye on their child getting worse. In other words, their breathing becoming difficult, becoming dehydrated or confused or lethargic, and that's the key role of the parent. Our research is finding that for most children, these antiviral drugs are probably not going to have a very big effect.